As of January 7, 2025, the Human Metapneumovirus, HMPV, is raising concerns globally, particularly in light of recent outbreaks. Data indicates that HMPV is more deadly among vulnerable populations such as children, the elderly, and immunocompromised individuals. According to the CDC in China, HMPV has been linked to increased mortality rates in severe cases where patients often experience co-infections with other respiratory viruses. Children, immunocompromised populations, and the elderly are susceptible, the CDC noted, highlighting that while HMPV typically presents with mild symptoms like cough and fever, it can lead to severe conditions such as bronchitis and pneumonia in severe cases. Research published in Lancet Global Health reportedly reveals that approximately 1% of acute lower respiratory infection-related deaths in children under 5 can be attributed to HMPV. Furthermore, a study indicated that the in-hospital mortality rate among patients with severe acute respiratory distress syndrome, ARDS, due to HMPV was as high as 36.4%. This data underscores the potential severity of HMPV infections. Despite these statistics, health officials like Dr. Atul Goel from India's Directorate General of Health Services have reassured the public that the situation is manageable. Hospitals are also prepared for seasonal respiratory illnesses, and standard preventive measures can significantly mitigate risks. A study found that the all-cause mortality rate for patients with cancer who were diagnosed with human metapneumovirus, HMPV, was 4% at 30 days. The study also found that patients with upper respiratory infections, URIs, had a 0% mortality rate, while patients with lower respiratory infections, LRIs, had a 10% mortality rate at 30 days. A study published in The Lancet also found that among patients with severe community-acquired pneumonia caused by HMPV, the 30-day mortality rate was 24%, while the 60-day mortality rate reached 32%. This suggests that patients with severe HMPV infections face considerable risks, similar to those with influenza virus infections. Research also shows that about 12% of patients hospitalized with HMPV required intensive care unit ICU admission, with similar rates observed for influenza and RSV. A comprehensive analysis estimated that HMPV accounts for about 8% of acute lower respiratory infection cases and contributes to 3 to 10% of hospital admissions for these conditions. So while HMPV poses a threat to certain populations, awareness and preventive actions are key. Stay informed about symptoms and seek medical advice if needed.